show for today. And Dr. Madu, let me encourage you to continue to give us the kind of information that you're giving us, because some of this, you know, I consider myself well informed about a lot of things, but some of these things are almost astounding to me. Go on, talk about the president not being there.
Yeah, I talked about these Boko Haram people before we left, who were creating mayhem, burning down, destroying things, you know. Eventually, they sent in some soldiers to quell the rebellion, so to speak. Of course, when the soldiers arrested some of the leaders, they shot them on the spot. Okay? Why? Because they didn't want to bring them to trial, because the leaders are going to mention the high-ranking politicians in the north who's been sponsoring them. Okay? Yeah, they need money to buy those guns and feed their own army and all the rest. Somebody was paying them. They didn't want them to come out. And who is sponsoring all these things? Okay? We heard that the president is in Saudi Arabia. Yeah, Saudi Arabian government has been putting a whole lot of money in northern Nigeria, you know, preaching their own brand of Islam, which is what they call the Wahhabi type of Islam, the strict puritanical Islam. Okay? Yeah. Now, the president of Nigeria is in Saudi Arabia. Somebody will ask, why should the president of a country as wealthy as Nigeria, 15% to 20% of the oil we use in this country comes from Nigeria, be sitting in Saudi Arabia? Okay? Why couldn't that president be treated in his own country? Okay? Anytime a president of a country puts himself at the mercy of another country's hospital, national security is involved.
It certainly is.
Okay? National security is involved. Even Cuba, as poor as they are, Fidel Castro is sitting there in their own hospital in Cuba, okay, being treated. Nigeria could afford to build 20, 30 hospitals better than the one in Cuba to treat our leaders. But every time they get sick, the governors, the president, the head of the country, running down to the United States, to Britain, to West Germany, you name it. Okay?
Without understanding the security risk
Without
that's involved
understanding
with
security risk. And moreover, what does he tell you? They don't care about their own people. We can afford to go out and get treatment. Hey, if you're a poor Nigerian, sit down there and die. We're not going to build the hospitals. But that's precisely the message.
This is the largest state in West Africa, on the continent of Africa.
Exactly, 150 million strong. Okay?
So this
with all the money you can talk about. And yet, you can have a hospital that can treat your own president in your own country.
And he's been missing for 2 weeks. 2 weeks as far
2
as
months.
2 months as far as everybody's concerned.
Since November, yeah. Because no Nigerian can say they've seen him with their 2 eyes. Okay, members of the House of Representatives and Senate in Nigeria, which is equivalent to your Congress, have gone there to see him. They won't allow them to see him. This is elected representatives of the Nigerian people. They're not allowed to see their own president, because the Saudi Arabian government won't allow them, and his wife won't allow them to see him. Can you understand that?
No, that's hard to understand. Okay. That's really hard to understand. Okay. You know, I mean, you talk about 150 million people.
That's correct.
A security force of 200,000 folks. Police force of 200,000 folks, and then they can't protect the president or whatever?
No. Okay. The president is in Saudi Arabian hospital of all places. Why? Why Saudi Arabia? Okay? Why any country? You should be treated in your own country.
That's right.
Your job as president or governor is to provide those things in your own country to take care of yourself and your own people. Before he became president, which you say he was imposed, really not elected, before he was imposed on the people in 2007, he was governor for 8 years in a state called Katsina, and he was sick. Okay, he didn't see it convenient to build a hospital even though he was sick in that state where he was governing. That tells you exactly the mentality of the Nigerian leaders. Okay, he didn't see fit to do that. Okay, before they imposed him on the country, those who imposed him knew he was sick, as he was. Okay. Yes, a majority of people in Nigeria knew he was sick, and they were saying, "Hey, this man is sick. Don't put him there." They shut their ears
and installed him anyway.
In this country, if you're running for president or governor, people want to know the state of your health.
Yes, certainly.
It's their right to know.
In any country, right.
Exactly. It's their right to know. It's not a secret.
You know, but Dr. Madu, we have talked, and I've talked to you on so many occasions on this very show, about democracy in Nigeria. I mean, we've talked about that, and we've talked about the election of 2007 and all that kind of information.
Yes.
But it seems that all of this is simply gone away. There's no more, nothing resembling democracy in Nigeria.
Absolutely.
Is that what we're saying?
Absolutely, because the people don't have a say. They have a say in what those supposedly imposed on them are doing. They don't have a say at all. Okay, they don't have nothing to say. Okay, the governors come here when their wives are pregnant to have their babies here. And you wonder, what about your hospital there? Okay, now the poor person in that country can afford to do that.
That's right.
Yeah, let him or her go there and die. No problem. We can afford to come here. I asked one of my friends in the State Department a few months ago, that said, why don't the State Department say, hey, any governor in Nigeria, when you're sick, don't come here. Stay over there. In that way, they will think twice and build the hospitals. Exactly, they build the hospitals. But they know if I'm sick, just get a visa to go to London or United States or Germany. Let the poor man die. No need building hospitals. That will continue. And that, as I said that to even the Assistant Secretary of State, when he talked about community involvement in trying to change Nigeria, I say, hey, you all got to help Nigerians.
That's going to continue. There's no way to break that cycle.
That's correct.
It appears to me the way it's playing out here.
You can't break the cycle the way unless you help us break that cycle. That means you have to say, hey, if you're a governor of a state in Nigeria, when you're sick, don't come here. Stay over there. In that way, you have to build that hospital, or otherwise you die like the regular people. Okay?
But when we talk about